My first guest is Corey S. Maas, MD. Dr. Maas is board certified by the American Board of Facial Plastic and Reconstructive Surgery. He is the founder and medical director of the Maas Clinic in San Francisco and Lake Tahoe. He is here today to discuss the keys to a natural-looking facelift. Dr. Maas, welcome to the show.
Thank you for having me, Randy.
Now, we've had you on the show talking about minimally invasive techniques, but for those that don't know you, tell us about your background, your training.
Well, I did my medical school training in Florida at the University of Florida, and then went on and did head and neck surgery training in St. Louis. Finished my plastic surgery training at the University of California, San Francisco in San Francisco, where I stayed on the faculty there as the director of the facial plastic surgery program for about 12 years. This traditional facelift doesn't do a good job of that.
I've been told you 10 years ago, and I could be wrong, that you were not addressing the mid-face.
That's correct. Up until recently, the mid-face was largely unaddressed. You certainly would get good contour of the jawline and neck area with our facelifting techniques.
So how has that changed the result, the appearance of a facelift?
Well, again, it gets back to what we were talking about before with balance and harmony. We were able to restore the jawline, the lower face and neck area, but then we still have hollowness under the eyes and the deep fold. We can add a percutaneous mid-face lift, what we call a mini cheek lift, and do it alone, or we can do it with a facelift and really help to restore the cheekbone area, the fullness under the eyes that's lost as what we call a negative vector, where those fat tissues drop down below the eye and create a deep fold and hollowness. So the myth about it being weeks or months of recovery, in fact, in some of the techniques that are being used today, these deeper dissections and all the more extensive procedures, which really have proven not to last any longer.
So what do you say to those surgeons that say the only way to achieve a natural-looking facelift is to go deep? Well, aggressively go one of these deep plane facelifts.
Well, there's nothing wrong with working in the deep plane, and there's a lot of misunderstanding even amongst surgeons about the deep plane. For us, the deep plane is working in the muscle layer, but we use the muscle layer to recontour the tissues. That's where the pull is. The pull is not on the skin. It's working in that muscle layer, the layer that we call the SMOS layer, not related to my name. It's the SMOS layer. We pull on that layer, that's where the tension comes. It's restoring that muscle layer to where it was when the patients were younger.
So you're repositioning the muscles, the underlying tissues?
Well, not the muscles themselves, but the muscle layer. It's a very thick connective tissue. It allows us to recontour it. It's what's really sagging down. Once that's recontoured, we can simply just redrape the skin with minimal tension on it.
Are you pulling up? Are you pulling back? What are you doing?
Well, that's a good question, because I think a lot of people think that you're just pulling straight back on the face or the skin. And in fact, the best results are achieved for natural contour. And this is a key. We want to have a facelift that looks natural, looks like you did when you're younger, not like you had plastic surgery.
I could always spot one, though. I could spot a facelift. Now that I've interviewed some plastic surgeons, I feel like I could spot one 20 yards away.
If you can spot it, it wasn't done well. That's my answer.
Is that right?
A good facelift, you can't tell the patient's had a facelift. And the way we do that is by contouring in multiple vectors. We're not just pulling straight back. We're using that muscle layer that I described to you. We're pulling in multiple vectors to restore the natural.
Multiple vectors meaning what? Directions?
Multiple directions, yeah. They're a vector of pull. There are multiple directions of pull on that muscle layer to restore the natural contours of the face that the patient had when they were younger. Then we can simply redrape the skin with minimal amounts of excision of the skin itself, minimal amount of pull in the skin itself, and get a very, very nice natural facelifting result that looks great.
What about the incisions? Where are you making those?
That's a good question, Randy, because there are people out there that are surgeons that are out there that are very dogmatic about an incision needs to be in this exact place on every patient. I don't agree with that. I think it depends on where the patient's hairline is. Some men and women have a lower hair tuft here, and if they have a lower hair tuft in this area, we're able to make an incision behind the hairline. So
are you able to hide them?
And we can hide it completely in that way. For patients that have a higher hair tuft, we're going to follow right along the hair with a little wavy line. The incision is barely visible once it's healed up. Same with behind the ear. You can wave it along the hairline itself, or you can go back in. Typically back here, if they have enough hair, we're going to go into the hairline. We're going to hide the incision behind the little piece of cartilage here called the tragus. So there's virtually very little of this incision that's going to be visible to the naked eye because it's all hidden in lines, creases in the hair. Plastic surgery should not look like you had plastic surgery. It should make you look younger and better.
So that pulled back tight look in the hands of the surgeon.
It's in the hands of the surgeon.
So again, give us a recap, the keys to a natural looking facelift.
Well, I appreciate you letting me do that part of it, Randy, because I think it's so important that people don't understand sort of the process. And what I would like to be able to do is sort of show you what people ask about and what the process looks like, how we make an analysis and how we look at the patient.
Okay.
So if we go to our patient here, a very good example. This particular lady is very interesting because she's a lovely person inside and out, and I can see on her face, I can see right through a lot of the lines and wrinkles.
So what's going on there?
She's got concerns primarily about her lower face. We talked to her about her upper face. She's got some drooping of the eyebrows, which gives her sort of an angry, worried look. Now, Randy, look at the after photo.
Wow.
You can see that her jawline is restored. It's a nice curvilinear jawline.
Difference.
She's got a very nice soft neck contour, as you can see here. She's got a lot of, all those wrinkles or sort of parenthesis lines around her face are completely restored. And how did you do that?
That just...
Again, that is part of the technique and part of the art of this.
Let's look at another photo.
Well, this is a good picture because more and more men are coming in for this type of surgery, Randy. I don't want anyone to think that this is just about women's surgery. Men are coming in all the time. They want to look better. They're living older just like women are.
So this is a guy that I would not guess would ever do anything.
And that's exactly right. He's a grandfather, but he doesn't want to look like a grandfather. This is the kind of...
these are extreme makeovers.
No, they're extreme makeovers, but the funny thing about the extreme part is that when I watch the show, I see people recovering for weeks or months. These patients look like this in 10 to 14 days after the surgery.
People had a lot of things going on, neck, jowling. What about just the mid-face? They're dropping in the mid-face, and you talk a lot about that. What do you do there?
Right, and I think it's important to understand that some patients don't have all this stuff. The mid-face may drop earlier and may create these deep folds and the hollowness under the eyes before you get neck problems, before you have a loss of your jawline, and this percutaneous mid-facelift, this mini cheek lift that we've described.
Called a cheek lift? What do you call it?
I call it a percutaneous mid-facelift. And
okay.
Mid-face lifting has gone through a whole evolution in plastic surgery. There are people describing coming through the hairline and elevating the tissue off the bone and going behind the eyelid and lifting up the tissue off the bone. We're doing this with tiny little incisions in the cheek here, just a little punch, and behind the hairline a little incision. And we're able to elevate this thing without all that recovery or dissection. People can come in the office and do this if it's just the mid-face alone.
Now you're teaching this.
We've taught it. We've actually had television shows out filming us doing it, so that it's been a very successful procedure for us to give long-term results in mid-facial sagging. And it's an alternative, again, to some of the fillers that might be used in the fold, because the etiology or the cause of the deep fold is the sagging down of that mid-facial tissue.
Are the patients, is this for the younger patient? The mid-facelift?
Typically it is. I mean, some patients, this is very often seen in younger patients alone when you have the mid-facial sagging. We'll often combine this procedure with a facelift.
What are the common misconceptions? We're just about out of time. Somebody watching this, fears, maybe lay some of those to rest.
The first ones that people talk about in facelifting in general are about anesthesia. Anesthesia is safe now. It's very effective. It's not like it was 10 years ago where there were the gas inhalational anesthetics. For most patients, they can do it with a small infusion. When they turn it off, they're awake and they feel good. So the safety factor is definitely there. Well, I think that people are concerned about scarring. We've addressed that, Randy. It's hidden. It's very difficult to see. People are concerned about the sort of stretched, windswept look. Done properly, people shouldn't know you had a facelift. And the third one, I think, is in recovery time. People shouldn't be thinking this in months and weeks and years after their procedure. They should be back doing normal social functioning things in 10 to 14 days after the procedure.
Now, on the consultation, do they always meet with you or one of your nurses?
Always meet with me. My patients meet with me. We do a computer consultation and imaging. I'm able to show them what they can look like after the procedure so that they can get a visual perspective of what their expectations
And that's pretty
may be.
accurate.
And it's very accurate. When done appropriately, I mean, the key for me is to make sure that I'm giving them an expectation that's reasonable so that at the end, we're all happy about the outcome.